Artificial intelligence doctor. User question. What are the long-term histological and cellular changes in cardiac tissue surrounding a leadless pacemaker, and how do these changes affect device performance and overall cardiac function over time? GPT-01 answer. Leadless pacemakers are a relatively recent advancement in cardiac rhythm management, designed to address some of the complications associated with traditional transvenous pacemakers, such as lead dislodgement, infection, and vascular complications. Implanting a leadless pacemaker involves delivering a self-contained device directly into the right ventricular myocardium via a catheter-based approach. Given their direct contact with cardiac tissue, understanding the long-term histological and cellular changes in the surrounding myocardium is crucial for assessing device performance and overall cardiac function over time. Long-term histological and cellular changes. Fibrosis and fibrotic encapsulation. Formation of fibrous tissue. Over time, the myocardium may develop fibrous tissue around the implanted device. This is a natural healing response to a foreign object. Capsule formation. A fibrous capsule may form, encapsulating the device. This can stabilize the device, but may also impact its interaction with the surrounding tissue. Inflammatory response. Acute inflammation. Immediately after implantation, there's an acute inflammatory response characterized by infiltration of neutrophils and macrophages. Chronic inflammation. Over the long term, chronic inflammation may persist, marked by the presence of lymphocytes and plasma cells. Endothelialization. Surface integration. The device surface may become endothelialized, integrating it more fully into the cardiac tissue. Reduction of thrombus formation. Endothelialization can reduce the risk of thrombus formation on the device surface. Foreign body reaction. Giant cell formation. Multinucleated giant cells may form as part of a foreign body reaction, attempting to phagocytose the device material. Granuloma formation. Small granulomas may develop around the device components. Myocardial remodeling. Cellular hypertrophy. Adjacent myocardial cells may undergo hypertrophy due to mechanical stress. Altered extracellular matrix. Changes in collagen deposition can alter the extracellular matrix composition. Microvascular changes. Neovascularization. New microvessels may form to supply the area, potentially affecting local blood flow. Ischemic changes. In rare cases, compromised blood flow may lead to localized ischemia. Impact on device performance. Electrical impedance changes. Increased pacing thresholds. Fibrotic tissue can increase the electrical impedance, requiring higher energy for effective pacing. Sensing difficulties. Changes in tissue conductivity may affect the device's ability to accurately sense intrinsic cardiac activity. Mechanical stability. Device fixation. Fibrous encapsulation can enhance device stability, reducing the risk of dislodgement. Extraction challenges. If device retrieval is necessary, fibrosis can complicate extraction procedures. Battery life implications. Increased energy demand. Higher pacing thresholds can lead to increased battery consumption, shortening device longevity. Software adjustments. The device may need reprogramming to adjust for changes in tissue impedance. Risk of device malfunction. Encroachment on device components. Tissue overgrowth may interfere with device components, potentially leading to malfunction. Leadless device integrity. Chronic inflammation may, in rare cases, compromise the structural integrity of the device. Impact on overall cardiac function. Local myocardial function. Contractility alterations. Fibrosis can stiffen the myocardium, potentially affecting local contractility. Arrhythmogenesis. Scar tissue may become a substrate for arrhythmias, such as ventricular tachycardia. Global cardiac function. Minimal impact expected. Generally, the small size of leadless pacemakers means that global cardiac function remains largely unaffected. Heart failure considerations. In patients with existing heart failure, any additional impairment in myocardial function could have more pronounced effects. Risk of complications. Perforation and erosion. Chronic tissue changes might, in rare cases, lead to device erosion into adjacent structures or cardiac perforation. Thromboembolic events. While endothelialization reduces this risk, incomplete coverage might predispose to thrombus formation. Conclusion. Long-term histological and cellular changes surrounding leadless pacemakers primarily involve fibrosis, chronic inflammation, and tissue integration processes like endothelialization. While these changes can impact device performance by altering electrical thresholds and mechanical stability, they generally do not significantly affect overall cardiac function due to the device's small size and the heart's compensatory mechanisms. However, increased pacing thresholds and potential challenges with device retrieval are clinical considerations. Ongoing monitoring and research are essential to fully understand the long-term implications, optimize device programming, and manage any arising complications effectively.